Well, hello there. It's 2025. And just when you thought things couldn't get any more bewildering, along comes a new debate about Medicaid. Yes, that program, the one that helps millions of Americans access health care. Apparently, it's now the subject of a moral component, according to House Speaker Mike Johnson. He believes that some people, specifically able-bodied individuals, are essentially defrauding the system by not working. The core of this new moral push is a bill recently passed by the House. It proposes stringent work requirements for Medicaid recipients. The argument, as presented by Speaker Johnson, is that work provides dignity and self-worth. And while, yes, meaningful work can be beneficial, one might argue that access to life-saving medical care also contributes significantly to a person's dignity. This has real-world consequences, potentially affecting millions. The proposal suggests that if you're an adult on Medicaid and deemed able-bodied, you better find 80 hours of work, training, or volunteering per month, or else. The or else being, you guessed it, losing your health coverage. This isn't just about budgets or policies, it's about people's lives, their health, and yes, their dignity, the kind that comes from not having to choose between medicine and food. All right, let's dissect this legislative marvel, shall we? The bill, a significant reconciliation package, squeaked through the GOP-controlled House on May 22, 2025. The vote was incredibly narrow, 215 to 214. This bill is a bit like a turducken of policy-stricter Medicaid work requirements inside an extension of Trump's 2017 tax cuts, all wrapped up in a $4 trillion debt ceiling raise. And for dessert, a ban on taxes for tips or overtime. The centerpiece is the new approach to Medicaid. For the first time, work requirements would become a federal mandate. We're talking 80 hours per month of work, job training, or volunteering for able-bodied adults. The plan is to kick this off on December 31st, 2026. Nothing says fresh start like the looming threat of losing your health insurance if you can't meet a monthly quota. This is a fundamental shift in how Medicaid operates. The introduction of a federal work mandate changes the very nature of the program, tying healthcare, a basic human need for many, directly to employment status in a way that hasn't been done nationally before. And who supported this grand vision? Well, in the House, it was a strictly partisan affair. Every single Democrat voted against it, an agenda that seems to think the biggest problem with poverty is that poor people just aren't working hard enough at not being poor. Now let's turn to the justifications, the grand pronouncements from on high. Speaker Mike Johnson argued that able-bodied individuals who refuse to work are defrauding the system. This powerful accusation conjures images of shadowy figures siphoning taxpayer money. But is that really what's happening here? Forcing someone into any job under threat of losing health insurance isn't a recipe for genuine self-worth. True dignity comes from knowing that if you get sick, you won't be financially ruined. So, while politicians talk about morality and fraud, let's look at what the actual numbers people are saying. The Congressional Budget Office, or CBO, they're the folks who do the math on these kinds of things, generally without a partisan axe to grind, has some rather startling projections. According to their analysis, this bill could lead to approximately 15 million people losing their health coverage by the year 2034. Yes, 15 million. Breaking that down further, the CBO projects that almost 8 million of those 15 million would lose Medicaid, specifically due to these new requirements and other changes. Think about that. 8 million people. That's more than the entire population of Speaker Johnson's home state of Louisiana, several times over. It's a staggering figure, and it raises serious questions about the true cost of this moral crusade. Is the supposed benefit of compelling a relatively small number of people to work worth the very real harm of millions losing their health care? It seems like a rather lopsided equation. This isn't just about numbers on a spreadsheet, of course. Each one of those projected coverage losses represents a human being, a family, a community potentially facing hardship. Mythbusters Medicaid Edition, Unmasking the Able-Bodied Loafer. Now let's address this persistent image of the able-bodied loafer, the person supposedly gaming the Medicaid system by choosing not to work. Speaker Johnson's argument hinges on this archetype. But does this person in large numbers actually exist? Well, data from the very same Kaiser Family Foundation suggests not really. According to KFF data, a whopping 92% of Medicaid recipients are either already working or are eligible for common sense exemptions. These exemptions aren't loopholes. They're for people who are caregivers for family members, students trying to better their prospects, or individuals with legitimate disabilities that prevent them from working. So what about the remaining 8%? Are they the defrauders Speaker Johnson is so concerned about? Well, that 8% includes people who are retired, those who genuinely cannot find work. Perhaps due to limited job opportunities in their area, lack of transportation or skills, mismatches, or are unemployed for other valid reasons. The idea that this small percentage represents a massive drain on the system due to willful idleness is frankly a stretch. This data fundamentally undermines the central premise of the work requirement argument. The fine print, more unpleasant surprises lurking in the bill. As if the work requirements weren't enough of a headline grabber, this bill comes packed with other provisions that could significantly impact Medicaid recipients and the broader healthcare landscape. For instance, the bill allows states to start checking Medicaid eligibility every 6 months, beginning at the end of 2026. This might sound reasonable, like a quick check-in, but in reality, it means more paperwork, more chances for administrative errors, and more opportunities for eligible people to lose coverage due to bureaucratic snafus. Then there are the more ideologically driven provisions. The bill explicitly prohibits Medicaid coverage for gender-affirming care for all individuals. This is a direct targeting of healthcare access for transgender people, inserting political ideology into medical decisions between patients and their doctors. Furthermore, it aims to stop states from using Medicaid funds to cover undocumented immigrants, a move that often shifts costs to emergency rooms and can have public health consequences. And in a move that will surprise absolutely no one familiar with these debates, it would also bar nonprofits like Planned Parenthood from receiving Medicaid funds, further restricting access to a range of health services for low-income individuals. Expert opinions. A resounding chorus of "Are you kidding me?" Experts agree. Medicaid work requirements are disastrous. Anthony Wright warns of devastating consequences. Susan Denser echoes these concerns. ACEP fears strain on emergency departments. Delayed care leads to ER visits, the most expensive option. History lesson: Arkansas tried it, and guess what? It was awful. Now you might be thinking, surely someone has tried these work requirements before. What happened then? And you'd be right. The state of Arkansas implemented similar work requirements for its Medicaid program a few years back, providing us with a real-world case study. And the results? Well, let's just say they weren't exactly a glowing testament to the policy's success. In fact, a study looking at the Arkansas experiment found that the requirements did not significantly increase employment among those targeted. What did happen in Arkansas? Thousands of people lost their health coverage. Many reported confusion about the reporting requirements or faced technical difficulties with the online portal used to report work hours. These weren't necessarily people refusing to work. They were people caught in a bureaucratic net, often struggling with unreliable internet access, complex rules, or simply not understanding what was required of them until it was too late. The policy ended up creating more hardship and anxiety than it did employment or dignity. The Arkansas experience serves as a stark warning. The big picture: ethics, healthcare chaos, and a wobbly path forward. So, where does this leave us? We have a bill, narrowly passed by the House, that proposes a radical reshaping of Medicaid based on a moral component that many find questionable. We have projections of millions losing coverage, data suggesting the core premise about able-bodied defrauders is largely a myth, and a history lesson from Arkansas showing such policies can be more harmful than helpful. This isn't just a squabble over line items in a budget, it's a fundamental debate about the role of government, the nature of social safety nets, and what we owe each other as a society. The broader implications for healthcare are immense. If millions lose Medicaid, hospitals, particularly rural ones already operating on thin margins, could face closures or significant service reductions. Furthermore, new eligibility requirements could also strip coverage from seniors and individuals with disabilities who are dually eligible for Medicaid and Medicare, a particularly vulnerable group. The ripple effects could be devastating and widespread. The bill now faces a skeptical Senate. This provides a crucial window for more thorough consideration, and hopefully a re-evaluation of whether these proposed changes truly serve the best interests of the American people. Thanks for watching, and please kindly hit the subscribe button to encourage us to produce more news content for you and other people around the world. Bye for now.